Hi everyone, wanted to review our information from week 4 and then also go over week 5 to come. I appreciate everyone's patience over the last couple of weeks. I'm hoping that today is the start of getting back on track. Um, so last week we talked about information technology. Hopefully you found some of that information interesting. I think oftentimes when we think about information technology, we just think about things like the electronic health record or things like that. And it's really so much more broad now, especially with the use of big data, artificial intelligence, all of those types of things, data analytics. So a lot of really good information. So I look forward to seeing everyone's infographics. And please be on the lookout. Sometimes I've found that students will submit a link for an infographic that I'm unable to open. So please, as I'm doing the grading for this, be on the lookout for an email from me if you did submit a link. Because sometimes folks will just copy and paste the link from their editing page, and that I can't see because I'm not signed into your account. So just be on the lookout if you submitted a link to make sure that I can see it. And if I can't, no worry, you're not going to receive a decrease in points or anything. I just need to be able to see it. So once I can do that, we should be in good shape. Week 5. So this week we're going to move into human resources and looking at the human resources function within healthcare. Interestingly enough, we do get quite a few students in the HSA program that really end up liking human resources and do internships in that area. And some, end up going into human resources. So one of our part-time faculty in the program is the vice president of human resources at Presbyterian Senior Care, and that might help to drive some of it as well because she's pretty passionate about it, and she teaches the HR class generally for the program. So we're going to talk about the roles and responsibilities of the human resources function, but we're also going to look at how human resources issues impact managers. So learning about human resources isn't just important for someone that wants to go into human resources, but it's important for anyone that wants to be a manager or an administrator in healthcare because you're always going to be dealing with human resource issues. Things like shortages of staff, issues with employees themselves, disciplinary action, regulatory issues related to employees, etc. So important to be knowledgeable and understand not just the personal aspects of it, but some of these regulatory aspects and things that HR folks face every day. If managers can understand that as well, then it helps to facilitate those issues. So we have our Flipgrid discussion. Make sure that you're doing your discussion when it states that it's Flipgrid. Make sure that you're doing it in Flipgrid. If you do it in the written discussion board, I won't see it and it won't get graded. So please make sure that you're doing those in Flipgrid. We have another group assignment this week. Your groups are different, so make sure that you take a look at your group and you'll do your assignment as a group. I encourage everyone to kind of set out a plan early in the week as far as calendar, when things are going to be done, all of that kind of stuff. And then you'll submit your group case study assignment to this box. And everyone will again do the self and peer review on your own, and you'll submit that here. So everyone will submit here. Only one person has to submit to this box from your group. And then we have a quiz and this ed puzzle. So let's take a look at a few of the questions from last week's quiz that were missed. First question, software applications in healthcare have traditionally been used to manage, and so all of these things here that are wrong answers are related to clinical stuff. Physicians, nurses, clinical staff, clinical operations. Traditionally, software applications in healthcare have been used to manage the finance side of the house. We've been using patient financial management systems and in software programs for things like general ledger and general accounting for dozens of years. The clinical side of the house did not warm up to the use of technology until much more recently. And I think we see that with regard to, we talked about the High Tech Act last week. The High Tech Act just came into play back in 2010, I believe, so only 10 years ago, where it was may have been slight, maybe 2009. But in any case, that's where the incentives came from the federal government for people to start to implement technology in the healthcare setting aimed at clinical care, so specifically the electronic health record. Prior to that, it really was not, prior to extensive use of the electronic health record, software applications were not traditionally used to manage clinical care. They were used to manage the administrative side of the house, and at that point, mainly healthcare expenses. So that is our correct answer there. Next question. Reports by what organization brought to the American public the issues and or opportunities in safer care through the use of computers? So our answer, obviously tons of answers here, but our correct answer is the Institute of Medicine. So remember in the discussions last week, or in the reading last week, there was discussion of a report out of the Institute of Medicine and then a report out of the Institute for Healthcare Improvement that both pointed to major issues in patient safety in our hospitals, and that in both of those reports, and the IHI is not listed here, so you could, if that was here, you could have answered that accurately as well. But the IHI and the IOM. IOM is a federal agency, the IHI is not, but these two, IOM is a federal institute, it's a research institute, and IHI is a private organization. But between those two, they both said one of the things that could help to improve care in hospitals across the nation was the use of technology. So specifically the use of the electronic health record and things like connections to lab results, connections to radiology results, connections to pharmacy, so that you're making sure that you're not making medication errors, and you're not giving meds to patients that they may be allergic to, all of those types of things. So they noted back then, and this was a long time ago, probably nearly 20 years ago at this point, that those were issues and they could be resolved through the use of computers. So Institute of Medicine is our answer here, but also the IHI, Institute for Healthcare Improvement, slightly later on said exactly the same thing. Next question. Delivery of healthcare lends itself to automation because it, again, lots of answers, I won't read them all, but mainly because it includes many repetitive workflows. So when you think about a situation like maybe giving meds in a hospital setting, they do exactly the same thing. They probably go to the med cabinet. In this case, now they're all automated. It brings up what meds you need. You get your meds out of that. You bleep different things. You then go into the room. You bleep the patient's wristband. You bleep the medication. Like, there's a lot of repetition in healthcare. Same with things like, same with things like laboratory services. So in the lab, much of the lab is now automated because it's the same thing over and over and over, and it doesn't. It saves time and money by having the computer do this activity, because if they automate it, it saves time for staff to deal with things that can't be automated, and it allows it to work more efficiently. So those types of repetitive workflows really, and many, many more, obviously things like patient billing, patient coding, the documentation in the medical record, all the same over and over and over. So by having this automation in place, it can really make things more efficient over time. So things like expensive, heavily regulated, comfortable with the use of technology, not in play here. It's all about the repetitive workflows. Okay, so that's all we've got for this week. If you have any questions on the work for the week, let me know. Again, don't forget to submit your self-assignment or self-assessment at the end of when you've submitted your project. And that's all I've got. So any questions, please let me know. Thanks.